Thank you for the introduction and for the invitation. I'm going to cover this fairly controversial subject, but a fairly hot topic these days. And I firmly believe that the gene that causes familial pancreas cancer is probably going to be discovered next year or two because of the technological improvements in genomics. So I think that this topic will become even a more interesting subject of debate over the next little while. This isn't exactly a happy story with a happy ending. I think that may be the message, the first message. And the other message that I want to leave with you is that this is investigational clinical research. This is not standard of care. And many of us are inundated by physicians and patients asking for screening because they're scared they're going to get pancreas cancer. So again, this is not standard of care. This is investigational research and should remain as such because we haven't at all fulfilled the criteria for a cost-effective screening test for this disease. But logically, if you're going to explore screening for a disease as nasty as pancreas cancer, you should start with the high-risk subjects. So that's what we've been focusing on in Toronto, and I'll discuss some of the experiences elsewhere. Again, this audience doesn't necessarily need to be reminded about the frequency of this disease and the deadliness of this disease. And naturally, again, prevention, secondary prevention, primary prevention would be great if we understood the pathophysiology enough that we could prevent this disease, but secondary prevention with screening makes a fair bit of sense if we have a screening tool that is effective. And again, what we've been doing and others around the world in the US and Europe have been attacking